In the headlines, PPP GCOM Commissioner says Bunraj accuses APNU-AFC commissioners of employing delay tactics to stall the declaration of the election's results.
It did not require any technical analysis to understand what the court was saying.
A leading elections lawyer in the Caribbean, Senior Counsel Anthony Astafan, says the Chief Elections Officer must prudently and lawfully comply with the CCJ ruling. A 31-year-old Letham resident is slapped with a 26-year jail sentence for the rape of a woman. The doctor in charge of the Kumako Hospital in Maruka Region 1, Dr. Darren Munsami, fears his battle with COVID-19. And in sport, Holder and Gabriel put West Indies in dominant position in first test against England. With the news, I'm Avenash Ramzan. Thank you very much for joining us. We started by telling you that the People's Progressive Party nominated GCOM Commissioner Says Gunraj on Thursday said he believes new delay tactics are being employed to stall the conclusion of the long overdue electoral process in Guyana. He was responding to the move by the three APNU-AFC nominated commissioners not to attend the meeting of the commission on Thursday by asking for time to study the judgment by the Caribbean Court of Justice, the CCJ. The CCJ in its ruling on Wednesday set aside the June 22 ruling of Guyana's appeal court and the June 23 report of the Chief Elections Officer, where he invalidated over 115,000 votes and refused to use certified figures from the national vote recount. Raj spoke with the Newsroom's Kurt Campbell.
I received an email earlier this morning which indicated to me that the meeting has been postponed to tomorrow, that no time has been set for that. In fact, it says that a time to be determined. And more importantly, the reason given for that postponement is the fact that my colleague commissioners from the other side require some time, and I quote, to study the decision of the Caribbean Court of Justice delivered yesterday. It required no gloss. It did not require any technical analysis to understand what the court was saying. And mind you, Justice Saunders made it a point to say after he delivered the ruling that it was a unanimous decision of all the members, all 5 members of the bench who sat and heard the case. What else? I expect the CEO to act in compliance, in ready compliance, perhaps as he acted or purported to act subsequent to the Court of Appeal decision, and provide a report in keeping with the diktats of the letter of the chairman dated the 16th of June, using the recount figures, and let's have this process done. Well, with the greatest deference to the chair, I believe that she has done what she ought to do. She summoned the meeting. She summoned the meeting of the commission. It is quite unfortunate, the position taken by my colleagues in relation to requiring time to study what is a very pellucid judgment. I have always been asking for the patience and common sense to prevail. I reiterate that call even now. But while I'm doing so, I'm recognizing that people's patience is growing thin, right? The collective patience of this country is probably at its lowest ebb. Now, that being said, I would like good sense to prevail. The facts in this matter speak for themselves, and I would like good sense to prevail so that this matter can be concluded in a timely and efficient way so that this country could get on with its lives.
The Newsroom subsequently confirmed that the GCOM meeting on Friday has been set for 13 hours. Now, the Citizenship Initiative, that's TCI, on Thursday urged the Justice Claudette Singh, chair of the Guyana Elections Commission GCOM, to do everything in her power to bring the election to its swift conclusion. TCI calls on Madam Chair to allow Guyana to breathe, the party said in a statement. The party expressed grave concern by the decision taken by GCOM to further delay the timely and lawful conclusion of Guyana's electoral process. TCI said it was mindful that the decision of the Caribbean Court of Justice on Wednesday has concluded, expecting all parties to move with haste. TCI emphasized the need for a quick end to the elections, saying Guyana and its people need it. Now, a leading elections lawyer in the Caribbean, Senior Counsel Anthony Astafan, on Wednesday night said Guyana's Chief Elections Officer Keith Lowenfield has no other option at this point but to comply with the ruling of the Caribbean Court of Justice, the CCJ. Kurt Campbell interviewed Mr. Astafan and filed this report.
Describing the recent actions of the Chief Elections Officer Keith Lowenfield as extraordinary and stunning, Dominican attorney Anthony Astafan Wednesday night told the Newsroom in an exclusive interview that the Chief Elections Officer must now produce his elections report to reflect the mathematical count of votes. The CCJ, in its judgment, set aside the June 22nd ruling of Guyana's Court of Appeal, along with the June 23rd report by Lowenfield, in which he said he had relied on the Court of Appeal's ruling, which amounted to an interpretation that more votes meant more valid votes. In that report, Lowenfield took it upon himself to invalidate over 115,000 votes to hand the incumbent APNU-AFC coalition a victory, although the certified figures from the national vote recount show a victory for the main opposition, People's Progressive Party. During the jurisprudential discussion, Astafan said Lowenfield's actions amount to an affront to democracy in Guyana and the Caribbean region by extension.
The facts that have occurred, the sequence of events that have occurred in Guyana in relation to this election are extraordinary facts. I don't think I have ever come across anything even close to having to deal with that. Once I was told about what it is that the Chief Elections Officer had done or was trying to do with GCOM, it was for me stunning because all of the allegations that were being raised, we could not find any legal basis for them being raised during the recount.
He said Lowenfield in the first instance had no authority to use the objections made by one political party and without any intervention by the judiciary to invalidate votes on his own accord.
No, because the CCJ declared that his report that he handed in with extraordinary speed after the decision of the Court of Appeal.
And if he attempts
I also had to, well, I mean, could somebody be so brazen to just submit the same document again? I mean, I don't know. I don't know the guy. The CCJ said that the judgment of the Court of Appeal, on which the Chief Elections Officer relies, null and void. They also took the extraordinary due process step of saying that his report is also null and void. That means there's no legal basis whatsoever. There's no longer a Court of Appeal decision in existence that he could rely on to try to pull that sort of stunt again. It's as simple as that. He now has an obligation to present the quantitative result of the count, because as the Chief Justice, as the CCJ said, and my learned friend just read, the core issues of these allegations can only be determined in accordance with the election jurisdiction process. That process can only be triggered by petition once GCOM declares the result or the winner based on the quantitative report from the supervisor of election. And thereafter, with the election petition, all of the other qualitative issues of fraud, residence, and so on can be determined. So there is no lawful basis, there's no legal basis upon which he could try to do that again.
But equally important, as he puts it, is the respect for the doctrine of separation of powers, where he insists that not only will Lowenfield be required to comply with the ruling of the CCJ, but also the executive government, including the President, his Attorney General, and by extension, the Cabinet. Kurt Campbell, Newsroom.
Now, following the ruling of the CCJ, top officials of the United States and Canadian governments have called on the Guyana Elections Commission, GCOM, to declare the winner of the March 2 polls based on the recount figures, which show a victory for the opposition People's Progressive Party. Quote, "The Caribbean Court has ruled it's time for GCOM to declare the winner of Guyana's election based on the national vote recount. The will of Guyana's voters cannot be ignored. tweeted Michael Kozak, the Acting Assistant Secretary for Western Hemisphere Affairs of the U.S. State Department. Joining him was Michael Grant, Canada's Assistant Deputy Minister for the Americas, who tweeted that it's time for the election's results to be announced by GCOM based on the recount. No more delays. Prior to the CCJ's ruling, diplomats heading the powerful ABCE countries met with the Minister of Foreign Affairs, Dr. Karen Cummings, emphasizing that the results of the national recount must be used to declare a winner of the March 2 elections. The diplomats at the meeting warned that there will be consequences if the results are not declared using tabulations from the national vote recount. And the former president of Liberia and a Nobel Peace Prize winner, Ellen Johnson Sirleaf, has warned of devastating effects for Guyana if there is no speedy conclusion to the ongoing 4-month-long elections process here. Sirleaf, who served as Liberia's 24th president and who is also a member of the powerful group, the Elders, founded by Nelson Mandela, on Wednesday reiterated that the group is satisfied that the will of the people was reflected in the March 2, 2020 elections and a national vote recount which showed a victory for Guyana's opposition party. She warned that if there are protests across the country because the will of the people is not respected, then there will be chaos and crippling effects for Guyana. The former Liberian president was at the time speaking with the president of the American Chamber of Commerce. Here's what she had to say.
I have been a part and a victim of a situation in which elections were held, the will of the people were very clear in the counting of the votes, and those results were not allowed to be announced, and for democracy to proceed in accordance with the will of the people. The effect of it is so devastating because people demand the right of choice. Governments and authorities need to work with them, and when that will is expressed, to give them the opportunity to have that right of choice exercised in governing the state. And when that doesn't happen, you cannot control events that would follow, because those who conclude that their vote has not been respected will show resistance. Sometimes we have to ensure that that resistance is peaceful, but no one has control over what happens. Once protests against not being able to see my vote carried out then transcends into dissatisfaction, it transcends into disillusionment, it transcends into people feel my future has been taken away from me because my vote has not been allowed, and you're dealing here with the majority of the people. It's a recipe for disaster. And that also invites external groups to come in to penetrate the workings of government and to take over. And then the state loses total control of the management of its resources, of its responses to its people. And we had 2 decades of conflict with damaging results in infrastructure, in institution, in the will of our people, in all of our systems. It is a situation that anyone who loves their country, anyone who's interested in the development of their country, must do all they can to avoid tensions, disagreements in elections being concluding in conflict, in damages, in destruction. My appeal to the authorities who manage the affairs of Guyana, my appeal to the people of Guyana, please see your country and the progress it has made in these last few years and protected. Please do not see this situation digress into violence, into destruction, because once you get on that path, it's so difficult to control it, and you never know what the final consequences will be. You will cause your own people to suffer. You will cause lasting effects to people's morale, to people's will to be able to serve their country, to your supporters on the outside who have done everything to get you to this place of progress, that will finally see you as being self-destructive.
Still in politics, Change Guyana on Wednesday night called on Justice Claudette Singh, the chair of GCOM, to act expeditiously and declare the PPP the winner of the March 2 elections. In a statement, Nigel Hines, the chair of the party, said the elections was turned into a circus and the reputation of GCOM has been tarnished. But he said Justice Singh can act to bring the matter to a close. He said the country needs a rational, inclusive and caring government at this time as the country battles the COVID-19 pandemic. Hines criticized the APNU-AFC for using the past year to maintain power and deny the will of the people. He called on the international community to start acting against the players, including constitutional agencies, which have aided the coalition in continuing to deny the will of the people. When the Newsroom returns, a Latham resident is slapped with a 26-year jail sentence for rape, and farmers in the East Berbice quarantine region are struggling with the contraband trade from Suriname. Stay tuned. 31-year-old Nick Skeet was sentenced to 26 years imprisonment on Thursday for the rape of a 20-year-old woman, which occurred between July 8 and 9, 2016 in Latham, Region 9. Skeet, known as Jason Blair and Shatter of Tabatinga, Latham, was sentenced by Justice Joan Barlow at the Georgetown Magistrates Court. On March 19, a 12-member jury found Skeet guilty to the charge, while his two co-accused, Harold Anderson and John Lee Edmond, were found not guilty. The probation report, which was read in court during a virtual hearing, revealed that in the past, Skeet was under investigation by the police in Latham for rape, but the matter never reached the court because the alleged victim returned to Brazil. Skeet told the probation officer that he felt powerless and believes that he was being set up. Meanwhile, the probation officer said the victim's father related that since the incident, she became withdrawn and very fearful around men. According to the probation officer, the victim suffered a horrendous bestial attack that would result in serious mental trauma. It is the state's case that the victim was in a taxi heading home when the driver was attacked. The young woman was then dragged from the car and raped. Farmers in the East Berbice quarantine region are struggling with the contraband trade from Suriname, saying it not only affects local businesses but could hamper the fight against the spread of COVID-19. Isnel Patwa reports.
The East Berbice Aquaculture Association has been lobbying the government for years to control smuggling from Suriname into Guyana, but have been unsuccessful. Secretary of the association, Sudat Prasad, in a telephone interview with the Newsroom, accused authorities such as the Ghana Revenue Authority, Ministry of Public Health and the fisheries sector of accepting bribes from the smugglers. The smuggling is now posing a threat to residents in Region 6, and according to Mr. Prasad, the residents are fearful of an outbreak of COVID-19 with the illegal border crossing.
When they bring in this goods and people coming back traveling, Suriname have actually about 500 cases COVID-19 right now. So if anybody infected and they come across, it will be very detrimental for the people involved this year.
Mr. Prasad explained that shrimps, fish, chicken and other goods are being smuggled into Ghana and sold for a lower price in bulk, competing with local businesses.
We can't compete with them because they have it bountiful, plentiful, and they make themselves very cheap. And our cost of production is higher. It's very high. So we can't compete with them. Okay. And most of the shrimps, like people when they come from outside, but these East Indian people, and let's buy it and take it back, like probably some over 100 pounds, 50 pounds, you know. So when they come down, they see the Suriname and cheap, they buy that, and separate the market.
Mr. Prasad said illegal ports of entry have been identified in numbers 73, 52, and 74 villages and in Port Morant and Albion. The association is pleading with the authorities to work together and prevent the cross-border smuggling, particularly as the country battles COVID-19. Farmers in the region are also faced with climate change challenges and underdevelopment. During the rainy season, farmers are unable to produce for months. It was also noted that some residents are not adhering to the COVID-19 measures in place to prevent the spread of the deadly disease. Reporting for the newsroom, I am Isanela Patwo.
We tell you now that Region 1 continues to see an increase in COVID-19 cases, and the regional chairman, Brenton Ashley, is calling for a partial lockdown of the Mabruma sub-district to avoid community transmission. Mabruma has so far confirmed 11 COVID-19 cases, of which only one person recovered. However, the chairman is fearful that the town and nearby communities can be faced with a case like its neighboring sub-district, Maruka, which has 82 cases thus far.
We have been working assiduously to encourage them to practice social distancing. The Mayor and Town Council, with the assistance of the Regional Democratic Council, would have put up hand washing facilities at strategic points within the town of Mabruma. We also are currently, we would have recommended a total lockdown of Mabruma to the regional task force, and subsequently the same recommendation being made to the national task force. While we may recommend for that, we do not support the total lockdown taking place unless it is properly thought out and systems such as relief systems for the people are put in place for families and so forth, because Region 1 has a high unemployment rate, and most persons sometimes are coming from very poor family background, and so a total lockdown will cause additional burdens to the already existing constraints that the communities and families have been facing in this region for some time. So we are also, besides recommending a partial lockdown, like of non-essential businesses such as rum shops and so forth, but to allow the essential businesses in the business zone of Kumako to be open.
Still ahead on the newsroom, the doctor in charge of the Kumako Hospital in Maruka Region 1 shares his battle with COVID-19, and over 100 Guyanese return from Canada. Healthcare workers are being hailed as heroes around the world as the battle continues against COVID-19. Nurses and doctors are putting their lives at risk every day while caring for infected patients. Dr. Darren Munsami, the doctor in charge at the Kumako Hospital in Maruka Region 1, is one of those who contracted COVID-19 while on the job. Isnella Patwa has a story.
Soon after Santa Rosa Maruka in Region 1 recorded its first COVID-19 related death on May 25, 2020, the doctor in charge of the Kumako Hospital, Dr. Darren Munsami, was placed in quarantine, but after 2 negative test results, he returned to work. The 34-year-old father of one has been working in the medical field since 2013 and started working at the Kumako Hospital 4 years ago. He was tested positive for COVID-19 about 2 weeks ago after returning to work. Dr. Munsami, during a telephone interview with the Newsroom Thursday, said he was working directly with COVID-19 patients, but somewhere along the line he took off his mask or maybe forgot to wash his hands.
The first symptom I was saying on the interview I had just now was pain in my left forearm. I had a broken wrist. Both bones are broken, and I felt the pain. I was like thinking, I wonder why. Anyhow, then I started getting a fever-like symptom. But when I checked my temperature, it was normal. And I felt unwell. I told the nurse I'm not feeling good. I checked my temperature several times, but it's not high. And in the night, I started getting fever. Got more severe then, and I felt, I wanted to probably bring up or something. I felt nauseous. Anyway, I got cough and cold and pain in my eyes. So I realized that, I was thinking dengue at first because of the pain in my eyes and the pain in my body and so on. But the cough and the cold, I said maybe this is COVID-19. I worked with COVID-19 patients. I probably contracted it somewhere.
Other symptoms Dr. Munsami said he experienced included shortness of breath, diarrhea, increased heart rate, high blood pressure, tremors, and burning in the nose. He reasoned that he only experiences these symptoms when he stresses about the situation. He is currently in isolation at the teacher's quarters in Moruca.
It's a bit tough being away and being isolated for this time. I knew it would be a big change for me. So I kind of made up my mind and so on. So probably that was the only thing that kept me not stressing about it too much. But there are days when I'm kind of depressed, and there are days when I'm upbeat. So it's an up and down kind of thing, a roller coaster, I guess.
Moruca, as of July 8, recorded 82 cases of COVID-19, 1 death, and 6 recoveries. Dr. Munsami's wife was tested negative for the disease. He was retested 4 days ago, but the results came back positive.
I started working with COVID-19 patients. So probably somewhere along the way, I probably took off my mask or didn't wash my hands or something along the way. But I can't only put my hand on it right now how I got infected. So once you're working with COVID-19 patients, you're seeing them all the time and so on, there's a high chance that you can be infected.
He believes that if more testing is done in Santa Rosa, about 80% of the population will test positive. Santa Rosa is the largest populated Amerindian settlement in the country, with a population of over 10,000. Reporting for the newsroom, I am Isinella Patpo.
And with over 200 cases of child abuse reported in the first half of 2020, the Child Care and Protection Agency and a non-governmental organization is moving ahead with the establishment of more child advocacy centers. The first to be established will be located at Wakhwani in Region 10 to conduct forensic interviews, provide therapeutic counseling, and other support needs for victims. Bibi Katoon reports.
The Child Advocacy Center is being established through a partnership with UNICEF, the Child Care and Protection Agency, a non-governmental organization Blossom Inc., and the Region 10 Democratic Council. During a visit to the center on Wednesday, the founder and managing director of Blossom Inc., Ayoda Getty Dean, explained that the facility will allow victims' testimonies to be recorded so that they will only have to tell their story once. This will reduce the trauma for the victim.
Now here at the center, we will conduct forensic interviews, therapeutic counseling, victim and court support. Now a forensic interview is where a child will only have to tell their story once. And that's hoping to reduce the trauma that the child feels, or reduce the trauma of them going through the system, retelling their stories over and over and over again. It's supposed to be a one-stop center. It is child-friendly and child-focused. Now we will work with the child and non-offending family members. As part of the forensic interview, a trained forensic interviewer will interview the child about the incident that has occurred. From there, they will then do the therapy, and the victim and the court support goes with that.
As of June 2020, there has been over 200 reported child sexual abuse cases, which is believed to have increased as a result of COVID-19 restrictions, which force persons to stay at home. According to head of the Child Care and Protection Agency, Anne Green, there have been an underreporting of child abuse cases in Wakhwani and surrounding areas. Coordinator of Blossom Inc., Melissa Chapman, related that persons currently have to travel from Wakhwani and the Reverend communities to Linden to access services, which may be a deterrent to reporting cases.
So initially, the clients had to travel from Wakhwani and other Reverend areas such as Araimo, Aichuni, The Veld, Bruni, Sandhills, and so forth to come to the Linden office. One of our main reasons of establishing this office in Wakhwani is to ease the pockets of the parents, because we know it's very costly for them to have to bring their children out to the center in Linden. So here, it's easily accessible and it's a center-based organization. We work collaboratively with the Child Care and Protection Agency, the Guyana Police Force, the hospital social worker.
A second child advocacy center will also be established in Timiri on the east bank of Demerara. The United Nations International Children's Agency Fund, UNICEF, in July 2019, donated $4 million in equipment including televisions, forensic kits, and computers to be utilized in the establishment of the centers. If you know of a child who is being abused, Contact the Child Care and Protection Agency's hotline on telephone number 227-0979. In Region 10, Blossom Inc. can be contacted on 608-6719 in Wakhwani and 659-6700 in Linden. Bibi Khatoon reporting for the Newsroom.
We now bring you an update from the Ministry of Public Health on Guyana's COVID-19 situation.
I will now bring you the situation in Guyana. As of July 9th, 2020, the total number of positive cases is 286. 125 persons have recovered and our COVID-19 deaths remain at 16. In institutional isolation, we currently have 145 active cases, 19 persons in institutional quarantine, and 6 persons in the COVID ICU. Fellow Guyanese, I wish to provide you with a disaggregation of our current data, which indicates the following. Region 1 is currently managing 69% of all active cases. 46% of all positive cases have recovered. 6% of all infected cases have died. A current survey conducted by the Ministry of Public Health in collaboration with UNICEF has indicated the following behavior patterns. Respondents from all 10 administrative regions have indicated that the level of fear of becoming infected with COVID-19 has decreased from 81.6% to 53.5% over a period of 4 weeks. 30% of respondents reported that they are unwilling to give up their daily practice and adhere to guidelines provided. Over 70% of respondents indicated that they wear a mask when out in public. 58% of respondents indicated that they observe the 6 feet social distancing as per guidelines. 76% of the respondents indicated that they wash or sanitize their hands frequently. Fellow Guyanese, you are being challenged to do your part. Respect the curfew, wear a mask, practice physical distancing, wash your hands frequently, and only venture out if absolutely necessary. Stay home and stay safe. Thank you.
And 141 Guyanese who were stranded in Canada arrived home on Thursday with the Canadian-based WestJet airline. The nationals are the first set of persons to return from Toronto, Canada, since Guyana closed its airports to international flights on March 17. They were all happy to be back home after waiting several weeks for their flights to be confirmed. Some of them spoke with the Newsroom after arriving at the Chadijagan International Airport.
I had contacted the consulate at the end of April, and a few weeks ago I contacted saying that the flight was available.
What was that experience like to know that you're being allowed to come back home? The first flight from Toronto actually, and you actually made it to that flight.
It was a relief. Honestly, I can't believe I'm here right now because I felt as though I was struggling for the 4 months that I couldn't come home. It was a bit tough finding the funds to stay in Canada on my own. I'm a student there, and with my school year done, I had nothing to do. So I was basically there kind of bored, kind of lonely, and being there alone during the pandemic without my family really took a toll on me. So I'm very relieved to be home right now.
The restrictions abroad is very strict, that's one. We've been indoors for actually 3 to 4 months. And it's glad to be here. The team, us, are very glad to be home, to be honest. Even though it's a bit stressing, the different procedures we have to go through, at least we're home and we're home safe. I would say, because, for me, safety is a big thing. And we should keep safe. Some people taking the virus as something jokey, but where we went, or where we were, it's very dangerous because simple things people get contact with, and you're trying to mitigate certain things. So you're trying to keep the distance, and for instance, if you know you have it, reach to the closest hospital as possible. Because everybody have children, have elders in the home, and those are the two people that the virus basically contact fast.
It's great. It's great to be back home after 4 months. It was it was devastating. It's good to be back home. Nowhere like home.
It feels wonderful, and I'm very relieved to be back home. 3.5 months. I should have been back March 26th. But then COVID, there was a lockdown. Luckily, I was with family. So we kind of made the most of it. We wouldn't have been able to spend all that time together if I hadn't been this delayed. So all in all, it could have been worse.
When the newsroom returns, the financial weather and bridge reports along with sport. Stay tuned.